food we eat is turned into glucose sugar. Once the food is digested, the glucose sugar is released into the bloodstream. When the sugar is in the bloodstream, it tells your pancreas. Pancreas no it making insulin. Your pancreas then makes insulin, which is supposed to pick up the glucose and have the cells, have glucose enter all the cells in the body. So then most of the cells in the body will take up some of the glucose from the blood. An important point here is the brain. The brain only relies on glucose. And if there's all the glucose in the blood and not enough getting into the brain, it can have some very serious consequences. Once glucose gets into the cells, it's broken down and used as fuel. Now, glucose is the main source of the body's fuel. There are other sources of fuel that the body uses, but glucose is pretty much the main source of fuel. And that fuel is used to provide energy for the human body. There are two types of diabetes. Type 1, the pancreas doesn't make insulin or doesn't make enough insulin. And if the pancreas is not making insulin, you have all that glucose staying in the blood. So if the glucose stays in the blood, that means we are not producing energy from that glucose. Because of that, the body starts to break down fat and tries to make energy from fat. When that fat is broken down, it releases fatty acids, and along with that, substances called ketones. These are acidic and toxic to the body. If this is not treated, it can lead to coma and death. It's called diabetic ketoacidosis. Very, very serious condition. The other major type of diabetes mellitus is type 2. With type 2, the pancreas makes insulin, but the cells stop responding to that insulin. Now, why do the cells stop responding to insulin? When we eat too much food, excess food gets turned into fat in the liver and also in the muscles. When there's fat in the liver and the muscles, these cells cannot take up glucose from the blood as well as they should. So that results in more sugar staying in the blood. The other reason why cells stop responding to insulin is weight gain. When we gain weight, we end up building a lot of fat in the abdominal cavity and around the organs. Some of the fats then, because it's just the fat cells are filled to capacity, some of that gets released into the blood as fatty acids. And it spills over into the muscle, spills over into the liver. And of course, those cells cannot take up as much of the glucose. So more glucose stays in the blood instead of getting into the cells and where they are needed for to be turned into energy. Another reason why cells stop responding to insulin is lack of exercise or lack of physical activity. When we exercise, the muscles are contracting, so they are actively absorbing glucose from the blood. This process does not rely on insulin, so we don't have to, the pancreas doesn't have to work at all. So that gives the pancreas a break, and this is extremely important because when we start exercising, it immediately reverses that process. So if you haven't been exercising, once you start, the muscles immediately start taking up glucose from the blood. So you see the results right away. Also during exercise, we build muscle mass, and some of the muscle mass absorb and store some of that excess sugar, which is usually in the blood. Now, when there's too much sugar in the blood, it can damage the blood vessels. This is a normal blood vessel, and these are various stages of damage in the blood vessels. When the blood vessels get damaged, the ones in the brain can result in strokes, The ones in the eyes can result in visual loss, kidney failure, nerve damage, neuropathy, very painful, heart attacks, and also blockages in the large arteries in the lower extremities. So the blood doesn't flow. If the blood is not flowing, some patients get wounds or cuts that don't heal. Some patients might end up getting amputation as a result. So what can we do? The first thing is to follow a low carbohydrate, low calorie diet. So we have to reduce the amount of carbohydrates we are eating, and we have to reduce the amount of calories that we consume. The recommended amount of calories for men is about 40, for women is 45 grams or less per meal, not for the day, per meal. And for men, it's about 60 grams or less per meal. The amount of calories for women is 1,200 to 1,500 kilocalories per day, and 1,500 to 1,800 kilocalories in men for the day. How do we do this? We have to start counting carbs. You have to know how much carbohydrates we are eating, how much carbohydrates are in the meals that we are eating. Most of the foods we eat will come with labels. So we have to start paying attention to the nutrition label. On the label, it's going to say how many servings are in the container and the size per serving. So if this were bread, one slice of bread will have 45 grams of carbohydrates. So you know that if you're allowed 45 grams of carbohydrates per meal, you've already exceeded the amount of carbohydrates that you're eating for that meal. So when you come down, you also can track how many calories you're eating, the amount of fat, total amount of fat, sodium, cholesterol. The total carbohydrates include sugar. So that includes the added sugar. So also we have to pay attention to how much sugar is in the carbohydrate section, because we want to pick foods that have low carbs, are also low added sugars. And part of the label also have some of the vitamins, if they do have vitamins. So it's very important to start paying attention to nutrition labels. For foods that we cannot measure, a good rule of thumb is that 1 cup of any food should fit in the palm of your hand. So when you make a fist, it should basically not exceed that fist. From the tip of our thumb to the base of the thumb is about a tablespoon. The tip of the index finger to the base is about a teaspoon. But in general, if it's carbohydrate and you cannot measure it, it should not exceed the palm of your hand or a fist. All right. And then portion plates are also very important to help us keep track and also eat the right amount of right portions of food. So half of a plate should be filled with non-starch vegetables. A quarter of the plate should be filled with our carbohydrates, and a quarter of a plate should be filled with lean proteins. Water is usually preferred. If you're not going to drink water, it should be a low, absolutely 0 calorie drink, but water is always better than anything else. So the half of the portion plates, your various vegetables, we try and avoid starchy vegetables, corn, potatoes, sweet potatoes, which are considered, sometimes considered vegetables here. Those can go to the portion for carbohydrates. The carbohydrates should be non-refined, so we have to avoid the highly refined carbohydrates and stick with whole grains and so whole foods. So whole potato is always better than rice, which is processed. And fruits go into your carbohydrate. Fruits have carbohydrates, so those go into this section as well. Your protein should be lean meats. So if you can see fat on the meats, you have to get out the fat or don't eat it at all. The protein, all our protein should be lean without fat or as little fat as possible. All right. So we went through this already. So the highly refined processed foods are your sodas, your juice, cakes, candy, the sugary cereals, sweets, chips, and cookies. Those are no for diabetics. Non-starchy vegetables, we all know that. And then we have to avoid the starchy vegetables. Fruit should be about 2 to 3 servings a day. Because fruits are considered healthy, some people eat a lot of fruit, but it should be about 2 to 3 servings a day, which is about half a cup to 1 cup a day, or a small or medium fruit. And the fruits should be the ones with low glucose and high in fiber. So berries have low glucose. They are also very high in fiber. Apples with the skin on, citrus fruits, peaches, and pears. Whole grains, brown rice better than white rice, whole wheat bread better than white bread, and so on. Also, our legumes have protein, so beans, lentils, chickpeas have protein. They also have carbohydrates, so in moderation. Oils, we sometimes forget about oils. Olive oil, avocado oil, canola oil tend to be the best ones. These are the worst oils to cook with. Palm oil, very fatty coconut oil, corn oil, soybean oil, vegetable oil. Any oil that is solid at room temperature is not good. Think of that oil as stuck in your blood and unable to move. So any oil that is solid at room temperature, we have to avoid. Sweetness. Some patients ask whether they should use sweetness or not. So artificial sweetness are generally not digested, meaning that they just go through your digestive tract and comes out through the stool. The artificial sweetness like Splenda, Equal, Sweet and Low, those alter gut bacteria in the long term. So in the long term, they can cause insulin resistance. Glucose is okay, it's fine to eat a little bit of sugar, just we pay attention to the amount of sugar that we are eating. There were some studies that showed that some artificial sweetness could cause cancer, but it was inconclusive. So we are not sure. So the best thing to do is a little bit of sugar and you should be good. The natural sweetness with 0 calories are okay also to use. Stevia, monk fruit, allulose, those are fine. They don't have those long-term effects that the artificial sweetness usually do. Sugar alcohols, these tend to be in baked goods, gums. Those have, they are partially absorbed though, so they don't completely go through the digestive system, but they have a lower impact on glucose, on your glucose than regular sugar. There are also natural sweetness, honey, maple syrup, coconut sugar. These are sugars, they are broken down just like regular sugars do. So, these should be consumed in moderation. They do raise the blood sugar, but not to the extent as table sugar, but they still do raise your blood sugar. There are some supplements that have been shown to lower blood sugar. Cinnamon is one of them, about 1 to 6 grams of cinnamon a day, which is about a teaspoon a day. Berberine, if you're taking berberine, make sure that your doctor is checking your liver enzymes, your liver tests, because it can affect your liver test. Magnesium usually is important for the nerve and muscle function. So that's how it helps with diabetes management. Again, if you're taking magnesium, you have to let your doctor know so they can check your levels, make sure you're not getting too much. Vitamin D has also been shown to lower glucose, and vitamin D levels are also checked in the blood. Alcohol. Alcohol is fine in moderation, but normally your liver will release glucose intermittently. If you drink alcohol, the liver just breaks down that alcohol instead of releasing glucose. So that can lead to low glucose, especially patients on insulin. That can sometimes lead to very low glucose, which can be could be life-threatening. Physical activity. So the recommended exercise is moderate intensity exercise. So you don't have to go and run a marathon. About 150 minutes of exercise, minimum 150 minutes of exercise for the week, which comes out to be about 30 minutes of exercise 5 days a week, or whichever way you want to spread it out. Combination of aerobic exercises, walking, jogging, swimming, treadmill, dancing, yard work, housework, sports, those all count as exercise and physical activity. This should be combined with strength training to build muscle mass. So planks, push-up, lunges, squats, climbing, crawling, yoga, and Pilates all build muscle mass. Weight loss. So when we lose weight, we are burning the fat that gets stored in the abdomen. This makes the cells more responsive to insulin. So then once insulin is released, the glucose can be taken up into the cells and not stay in the blood, and reduces that insulin resistance. Normal BMI, so everyone should know what their BMI is. BMI is basically your weight in kilograms divided by your height in meters squared. Normal BMI is 18 to 24 and 0.9. If you're overweight, your BMI is 25 to 29.9. If you're obese, BMI is 30 or higher. Morbidly obese, BMI is 40, or BMI of 30 with obesity-related complications also meet criteria for morbid obesity. Weight loss goal of about 5 to 10 pounds of body weight, 5 to 10% of body weight improves glucose and reduces insulin and medication requirements, and also improve mortality. Medications are usually prescribed for patients who are not diabetics. Medications are prescribed for weight loss when your BMI is 26. So if you go to your doctor, your BMI is under 27, you don't have diabetes, you ask for weight loss medication, the insurance companies will even deny it. So your BMI has to be 27 and up to qualify for medications. Patients who are morbidly obese qualify for weight loss surgery, and the goal for weight loss surgery is to lose at least 20% or more of your body weight. Routines are extremely important in managing diabetes. Developing a routine that fits your lifestyle and your schedule, because we all have different schedules. Going to bed, waking up around the same time helps because it keeps you accountable. And you're also able to remember to do things if you're doing them around the same time every day. We check the glucose, take medications at prescribed times. Meals have to be at set times, so not on the go. Breakfast, lunch, dinner. Some patients skip lunch, which is fine, but breakfast should be around the same time, lunch around the same time, dinner around the same time. And exercise should be specific days and times so you're not forgetting. All right. And then we encourage diabetics to see their doctors every 3 months or as scheduled. If you're doing well, sometimes your provider might extend that visit to 6 months. Diabetics get their blood work every 3 months. Patients on metformin, I forgot to put this on the slide, but patients on metformin can have low B12. So that your doctor should be reminded to check B12 periodically if they are not, because low B12 can cause nerve damage, further nerve damage, which some diabetics are prone to having. And diabetic eye exams at least yearly. Sometimes it can be extended to every 2 years, but typically should be every year. And then podiatrist, if you're having issues with your feet, wounds, you see your podiatrist as scheduled, and any other specialist that you're supposed to see. And that is pretty much it. So I will pause here for questions.
Thank you very much, Dr. Claudia.
You're welcome.
It's time for questions and answers. If anybody has a question, we'll take 3 questions at a time. She will answer them. Now you're proceeding further if there's extra time.
Frank Sechiyama.
Mr.
Hello?
Frank Pacho, yes. Ubetumi bisa question.
Yeah, Dr. Yadawasi, for
Oh,
giving
yes.
us this beautiful talk. Doctor, problem wider, is there any time in your age that you say, hey, at this age, I'm above diabetes, or diabetes can catch you at any age in your life?
Yes, very good question. Diabetes can happen at any age in life. So you still have to be screened, even if you're 80. Some patients get diagnosed at 80, as late as 80 years old. So yes, it can happen at any point in time. Yes.
Oh, that's too bad. I wish there was a particular age. Thank you, doctor.
You're welcome.
Pacho, Obi throw a question.
My pacho Innocentia ni.
Pacho, Ubetumi bisa.
My pacho doctor, what is the advantage of eating brown sugar over white sugar?
And see, white sugar, more refined. Brown sugar doesn't go through the entire process that white sugar goes through. Into brown sugar is better because and yet as refined as the white sugar.
Yo, medase.
Oh, nice.
What you make me be a question back on?
Pacho, Koso.
Okay. It's concerning the bar of fire phone, and they realized that the person's sugar was going up, and they gave the person insulin and metformin. Is that good for the baby and the person?
I know your friend of gestational diabetes. So for patients that they don't have diabetes until pregnancy, usually occurs around 24 to 28 weeks of gestation. Placenta makes hormones. Those hormones make the cells resistant to insulin. So that's why some patients do develop gestational diabetes. Diet is also important. Exercise is important. For patients whose blood sugar are too high, or if they're just not able to get it down with diet and exercise, insulin helps, metformin helps because they bring down the blood sugar. So blood sugar when get too high, it can cause complications during the pregnancy. And then the baby itself can also have complications. Medications are very important during pregnancy to bring down the blood sugar, especially insulin. We usually would typically prescribe insulin. Metformin is also safe to be used during pregnancy.
And mine, the question was that they give the person both metformin and insulin.
So metformin, maybe she had insulin resistance, but insulin is usually good enough. She doesn't need to be on both. Typically, insulin, two types of insulin. The basal insulin, you take that, once a day, sometimes twice a day, once a day, and then insulin before meals. Now, was she taking two types of insulins or just one?
Two.
Two, yes. So metformin is not necessary then at that point, unless she's requiring really high doses of insulin. But other than that, metformin is not necessary.
Thank you very much.
You're welcome.
Can I ask a question?
Oh, yes.
Yes, please.
Yeah. Is there any connection between like if you carry big babies, you will be
Yes.
diabetic or something like that? Because I remember when I was pregnant, I usually carry big babies. Jacobi Hospital, every week, I used to go to high risk clinic. They used to do the glucose test every week. But they said if I wasn't, I would be diabetic. But thank God that baby was 10 pounds. But still, at my age, I'm over 60. I am not diabetic. So, and my family, most of them are diabetic, but I'm not diabetic. So, I don't understand why they say if you carry big babies, you may be diabetic as time goes on, or if it's heredity, if you your family, most of them are diabetic, your parents are diabetic. Can you explain a little bit for me over there?
Yes. So it's not about carrying a big baby. It's really the egg before the chicken. So if you are diabetic, you have all that glucose in the blood. That some of that glucose is passing through the placenta to the baby. So then the baby becomes
Okay, I
big.
go fix upstairs.
The baby becomes bigger. So that diabetes is what causes the baby to become big. So it's not that if you have a big baby, then you're going to be diabetic. You have a big baby usually because you were or you are diabetic, if that makes sense.
Yeah, because I was scared when I get pregnant. I normally carry big babies. That if I'm not, I'll be diabetic. But thank God I'm not. I have no diabetes. Thank God.
Yeah, so that is not related to diabetes because you're not diabetes.
And I'm very active anyway. I'm very active. So thank God.
Yeah. So you
Thank you.
have nothing to worry about then.
Yeah,
Yes.
thank you, doctor.
Dr. Claudia, I have a question.
More question. It's in Bisa.
Yeah, Patrick, hold on 1 second. Memo, son, give me 1 second.
Okay.
And Dr. Claudia, my question relates to what Mr. Carl said, which is gestational diabetes. How does it work? Is it that is something transient that is supposed to go after delivery? And I say somebody gets it, there's a probability say Ebekaho is not going to go again. How does that work?
Yes. So if there's someone who never had diabetes, they develop it during pregnancy. Most of the time it resolves after pregnancy, but having gestational diabetes means that down the road, sometime in the future, that person is at risk for having diabetes. So it is very important to follow the diet, low carbohydrate diet, low calorie diet, exercise, weight management, so that person does not develop it down the road. But that usually is an indication that further down the road, that person might have diabetes. There are some patients who have it and it never resolves. So after they deliver, it doesn't resolve. So that they are pretty much diabetic from there on.
Okay, thank you.
Okay.
Pacho,
more question.
yeah, wait to me, Bisa.
Your Pacho program and come up para the summer fun coaching a project na the go for me to the public show.
Yeah.
Can I ask a question, please?
Yes, please. Mrs. Lucinda, me Pacho, wait to me, Bisa.
Thank you. Doctor, so what causes type 1 diabetes? And I have an issue where I have somebody that developed it probably in their teens or early 20s, I would say, around 1920. And they said it was associated with PCOS. I don't know. But we realized that she has type 1 diabetes, although all through her life, nothing indicated that she had type 1 diabetes. And now it's affecting her. She's on insulin, having to inject 4 times for every meal. So could you explain a little bit about that? I don't think I'm diabetic. I'm bordering, at my age, I'm bordering around pre, but I'm not there yet, thank God. I'm not diabetic, and I don't think her father is diabetic. So can you explain a little bit about that and how it happened? Yes.
Right. What these science is say?
No, I'm just trying to say, how did it come up, and is it related to the PCOS or it's on its own?
Oh yes, I was asking the age so I can put it in context.
Oh, okay.
Type 1. So pancreas, this is the pancreas no need. Pancreas no insulin, normally a make insulin. Now that insulin is what tells the body cells to take up glucose and put that glucose into the cells. For type 1 diabetes, they have an autoimmune condition. Autoimmune condition, yeah, when body cells attack themselves. Until they have antibodies that destroy the pancreas over time. And yet, usually sudden onset, a gradual. Once the pancreas starts to basically be destroyed, it gets to a point where a good amount of the pancreas is gone, and that person can no longer make insulin. The phase before the person develops type 1 diabetes is called the honeymoon phase. During that honeymoon phase, they make some insulin, so they are able to somewhat maintain their blood sugar, but it gets to a point where they just can't make enough to keep up. So that's why they develop type 1 diabetes. Type 1 diabetes means they are not making insulin from the pancreas at all. If they are not making insulin, that sugar stays in the blood. The sugar is not being taken up. And a lot of type 1s get diagnosed when they are in what we call diabetic ketoacidosis. So glucose blood pneumonia. The body starts to use fat to make energy because it can't make energy from glucose. So it has to make energy from somewhere else. It starts to use fat from the body to make energy. Along with that, it releases ketones. Ketones are very acidic in the blood and they're toxic. And if that is not treated, some diabetics can end up in a coma. That's how they are sometimes even diagnosed. And that is what is happening in that case. That person is not making enough insulin.
What is the treatment, if I may interrupt here, please? Is that what the treatment for that?
The treatment is insulin. Because they are not making insulin, no amount of pills will work for these patients. They have to be on insulin. They need it for life, basically. They can die if they don't go on insulin because they are just not making any. Now, PCOS, it's interesting that they said she has PCOS because PCOS tends to be associated with type 2 diabetes. So the PCOS probably was separate from what was going on because PCOS patients usually are insulin resistant, meaning that they are making insulin, but the cells are not taking them up. So usually they can, get the blood sugar down with diet and exercise. And so I would, depending on who did the workup, I would recommend that you have that patient see an endocrinologist if they haven't. They'll run the labs, make sure that that person is truly type 1 because PCOS is usually associated with type 2 and not type 1 diabetes.
Thank you, doctor. Thank you.
Yeah, with topic where a very, very important. A lot of people have challenges and there are language barriers. People already, somebody already requested. To me, I'm a more tree for them. Thanks.
Yeah.
Yo, wait there. Message is say most of bisa question now. Mumbisa the tree. And say I say yeah, ntibro for no. Na say question ya ebisa so. Yeah, the raw for na ebisa. Na no sa ko ebibi o. Madaro ma why? That was.
Mr. Carl,
Okay.
So
Number one
question area 1 second. Now they hand not perform so that I know said the episode beside is somebody on beside.
Sure.
You can go ahead.
All right, thank you very much. Okay, Doc. You stated that those with autoimmune diseases have their pancreas affected by the antibodies. So the root cause of these antibodies is probably the thymus gland, right?
It can be.
Okay, so is it possible if the thymus gland is removed, that antibodies could stop producing to affect the pancreas for the pancreas to redevelop?
No. So once the antibodies are being produced and released, the thymus gland, once we become adults, doesn't really play a role at all in our immune system. It's supposed to help with the immune system, but it really doesn't. So once, and it's not that active most of the time. So, most of the time it's not really from the thymus gland. It's just, these antibodies get released. Taking out the thymus gland, it will not reverse this process. It won't do anything for this. Yeah.
Thank you very much.
Madre no me pacho to me bisa question.
Yo, doctor, where the yes, bisa no tree mu me tree no me bomode. Pepacho wo kasafa aduane ho carbohydrate. Na wo se carbohydrate no enye te se wunsem. Wunsa yem se sa na efre na palm.
Aye.
Nti fa ne se yen Ghanafoɔ bebree yedi banku yedi fufuo. Nkwan no nso a bebree yɛyɛ no ɛyɛ nkatenkwan, abɛnkwan, kotodwe wom, tolo beef ne saa fatty eyi no. Ɛno saa no ebi a me sɛ medi banku mehwɛ me nsa a saa banku no ɛnso me. Egyi sɛ bi a mmienu. Nti ɛno saa no yɛbɛyɛ den etimi akɔntrol yɛ aduane no di. Ɛsiane sɛ aka yɛ hɔ firi tetete.
Nti sɛ banku no ɛyɛ baako a ɛbɛfiti inside nsɛm a the rest of your meals no ɛwɔ sɛ ɛyɛ vegetables. Nti instead of nkwan no wobɛtumi ayɛ okra stew without all the oils. Okra stew, okra no yɛ vegetables. Nti most of your plates no obetumi afele with the stew and fish or a protein open. Not banku no wejai for just what fits in the palm of your hand, if that makes sense.
Okay, thank you.
We'll replace a rest of the meals no with vegetables and your proteins.
Thank you so much.
Pacho, Mr. Patrick, I think so. Patrick Ebwa.
Yo, me da say. Doc, where the me question is a day na a day do body no me be mo hu say sa symptoms where the ABA okay kako sa diabetic situation. That's
Symptoms no say what bread for no reason just say what bread to the point that you can't even do anything that is a symptom. If you say cells no they have to use sugar. The sugar is in the blood. Energy from sugar no. Say we feel it thirsty. Say person unum so all the time. That's another sign. Unum so all the time. So pee. Those are also some of the signs. And say lose weight. You are not trying. Won't try to lose weight. Not lose weight for no reason. That is another sign of diabetes. So those are called symptoms. Those indicate that sugar near high. I was say ukohu doctor.
Thank you.
If I chose before for a question. Obi beside your baby say, are we all good?
So Obianya beside any about
Okay, go ahead.
All right. So what's the solution for a healthy pancreas?
Question or I missed a question.
How can you fix your pancreas?
Transplant. Some type 1s, no, they go on transplant list until they can get a pancreas transplant. Usually, only pancreas now, only kidney, so only a kidney transplant. Yeah, that is really the main solution.
Very much. But is there any food supplements that could be used on regular basis to improve the effectiveness of the pancreas?
The effectiveness of the insulin, probably not the pancreas. Once that process starts with the pancreas, no, that there isn't much. There is a medication though. Medication be about a bit to be prevented pre-diabetes from progressing. But patients are almost antibodies for type 1. No? Medication be out a bit to me a delay progression from the honeymoon, the pre-diabetes stage into type 1. But besides that medication and transplant, there isn't a supplement to really affect the pancreas, but there are supplements that can help with the insulin, the effectiveness of insulin, though.
What medication is that?
The supplements, Tzield, medication here, Tzield, Tzield. Fairly new into when medications are new, you don't want to be the first one to get them because we don't know what the side effects are. Once they've been on the market for about a year or so, that's when we really start to know the side effects. But yeah, that is a medication to ask if you have antibodies for type 1 and you're in the pre-diabetes stage or the honeymoon phase.
Very much.
Can I ask a question, please?
Make me a question.
Oh, yes.
Go ahead.
Yeah,
Doctor,
I
will ask a question from the chat. In Patrick, you'll be sunny. Then you allow me ask 2 people's question from the chat. Now you have to ask them.
my question, Doctor Pacho. Minim say nipa bebre no a omo diabetes no. Despite taking their medicines near there, and some ko be ya no the sweetness and not sweet and no maybe share some bag him. Obo ho a more program be a bit more say the sugar ko low ntini be a ye pe ade be sweet. I'm managing right away. Am I wait me? Anya na holding. Pacho, I don't know. Say nipa no use medicine no necessary say time be and also nya sugary sweets be wo the bag also use all the time ana.
Aye, very important, especially say who take insulin. And there are some medications like glucoside and blood sugar and drop. It's very important to have something with you all the time. If you say sugar can drop at any time, especially type 1s. Type 1s, they don't produce the hormone called glucagon. Glucagon usually regulates low blood sugar. But type 1s don't produce it because pancreas don't produce glucagon and it's not working. And blood sugar can drop at any time, and it's extremely important to carry glucose tablets, glucose drinks, and also emergency glucose kit called glucagon. Not just injection, but now a spray. Glucagon, it was said you keep it at home and train everybody at home how to use it. So blood sugar need drop or go low. Not untimi say you are just out of it. Untimi the untimi and no bibia. It was said obia or etimi know how to give you glucagon. Glucagon ebema blood sugar aba up instead of calling EMS, going through emergency. Glucagon will bring the blood sugar up very quickly. And so you should have both the tablets, drinks, and also the emergency kit.
Okay, thank you.
Mm-hmm.
Dr. Claudia, there's a question Ewa chatting. First one, Ibisa say, does parboiling white rice reduce the GI?
No. White rice is already refined, so it doesn't really do a whole lot, no.
Okay. And a second question, so Bisa say, can you get blood pressure through pregnancy? I'm assuming high blood pressure through pregnancy.
High blood pressure, pre-eclampsia, aye.
Okay. And Mami Odemi Pacho, you can ask your question.
Medase. Me Pacho, near me person who say, everyone say, we'll monitor who, what diets, what your diets, we'll monitor who so that we best stay low and without having challenges with this diabetes and stuff. And me person who say how low it is too low because sometimes me call low or not.
Also, diabetes and now only diabetes.
Oh, to be honest, me develop and my reverse.
Oh, okay.
And my reverse. And to me reverse, I'm very, very consistent. Me monitor me home. you know, many aduane bebree ho no ma megya edi mindi. But
very good.
yes, sometimes and so no ya na mitimu say me low. It's me person me hope how bad lower. Yeah, too bad for me.
I said blood sugar under 70 a low.
Oh.
And there are some patients blood sugar 80 you start having low blood sugar symptoms. Low blood sugar symptoms, no. A calm deal for no reason. We'll be sweaty. Sometimes we'll be shaky for no reason. At times, you can't even think. You're out of it. Those are signs of the low blood sugar. When the sugar is under 70, it's low. So you have to do something about it. You have to have something with sugar to bring it up. Sugar tablets and drinks, no, are good because they have the exact amount of sugar that you need to correct that blood sugar. At times, if you
Listen, you don't play with food.
No. But you're saying?
Will be next. So continue.
Those glucose tablets, the drinks, they have the exact amount. It's better than just grabbing something just to take.
I forgot your mom's birthday last week. On Saturday? Did she celebrate it?
And somebody paused
your dad was going to have a birthday. She sent
me. Is out of.
Yesterday that I saw it.
Oh, can you mute her?
Yeah. Okay. Me pacho. Okay, me pacho we.
Sugar go under 70 are too low. And now if you're having symptoms, if you're having low blood sugar symptoms are too low.
Okay. So me try
step on me, your feet will be stiff.
Me tries me maintain under 100. So mostly it's like between 80s and 100 is okay, right? Not too low. No.
That'd be a perfect range.
Okay. Okay. All right. Thank you.
Okay, the next question. Patrick, 1 second. Next question in the chat. Obisa said, does waistline or the size of your belly determine how risky you are close to having diabetes?
Indirectly, yes. So waistline determines how big you are, how much weight you've gained. And gaining weight, gaining weight, you can have diabetes. Yes.
Thank you.
Okay. Patronia, no person bisa question.
Patrol Kingsley name person bisa question back.
Okay, go ahead.
Doug, Patrol, I think that we all know the importance of exercising regularly, right? But as you say, my question is that in case somebody has been diagnosed pre-diabetic, let's say, or engaging in this regular exercise now, a being here say, I do baby no, ya man a draw cry diabetes in which may finish system man.
I say a pre-diabetes stage. And especially say only family history. I mean, it's a obese in the family more or diabetes. Type 2 tends to be genetic, meaning that usually there's somebody in the family. Say if both parents have diabetes, siblings have diabetes, and it's difficult to reverse it because you're already predisposed to having it.
Yeah, I know.
Especially if there's
somebody
in the family who has it, it can be reversed. And
some
people get
diabetes.
Why is she for?
Oh.
Some people get diabetes purely from weight gain and diet. That can also be reversed.
Okay, thank you.
You're welcome.
Is she crawling now or
Oh, iPhone 3, Ms. Patrick, can you mute yourself? And I'll still be some.
That's good.
Okay, so bisa question.
Putting out things.
Yeah, that's what she's doing.
Okay. I will come back tomorrow to visit.
Okay. Pacho, Doctor, the next person in the chat, Abisa say, does Ozempic, is it good for diabetes?
Yes, Ozempic, the way it works now. A curb appetite into feeling hungry. And the second way it works is it goes through your digestive system more slowly into a lot of it doesn't get absorbed. And because of that, people lose weight. So the weight loss usually leads to improved sugar into a year for diabetes. And of course, there are some patients who cannot take if you've had pancreatitis or inflammation of the pancreas, untimi emfa Ozempic. Your doctor will usually go through all of that, make sure that you can take it. But if your doctor determines that you can take it, good, for diabetes. Ozempic, Monjaro, a little bit better than Ozempic for diabetes. But both of those medications no help.
Okay. If I can know be episode bisa question.
Meti me a question. It looks like people are not
Okay.
asking. Can I ask
Ɛna
one
Okay,
meka
go.
sɛ mbusa.
Yes,
Madam
Auntie.
Maggie. Okay, sɛ mother na pagya ne nsa ama ne nkasa owie announce bisa.
Me mmusa me se me na mepagya me
Mepacho,
nsa bɛ doctor answer me question nti mehia sɛ mebusa bio.
Okay. Enti wobetumi de wo hand na perform so I know you are done.
All right, thank you.
Okay. If I shall go ahead.
okay, doctor, Mepacho. Well, sometime be minim say one more diabetic no. Na first one ta warm insulin. But de be me who mammy be Spanish ni mammy, me who be bit is a button. A bonin sechi. Intimate trip ben me nanti ben na me be say what is this on your arm? Also, we're diabetic na a release insulin into her system from time to time. Nam say thank you. Nam empesi me bisano further questions. Inti me pacho sadie no e bone we release insulin no. Akwese dro. Inti how long does it stay on their body? Was it be crowd bo womu yefunu ho? Inti eno sano, how long does it stay on their body to release that insulin into their system from time to time instead of tete hono atem bia na omo wo omo ho paneɛ no? I don't know, how does it work
Your
for
friend the insulin pump.
okay.
A very small device. I almost pick it up insulin from the pharmacy. Now they have to fill the pump, the device, and they have to fill it with insulin every 3 days, usually every 3 days, depending on how quickly they use up that insulin. It's almost fill it with insulin. Insulin, no, it deliver to them through a small tube that is basically underneath the skin, around the clock. Into around day 3, na insulin insulin level na format na almost injecting more. They have to replace it too. They usually have to replace the cartridges too. That's how it works. Sana working.
Yo, that's it.
Dr. Claudia,
Dr.
in the
Mpacho,
chat, Obi Bisao say, can you please mention examples of non-starchy vegetables? Into me abubo bidin at
Oh yes, let me pull up the slide. Me. Non-starchy vegetables, no, lettuce, cucumber, tomatoes, broccoli, green beans, carrots, cauliflower, okra, pretty much all of the vegetables except this country we consider peas, corn, and sweet potato as vegetables, but any of the vegetables basically except these 3. Not peas, not corn, not sweet potato, but anything else.
Okay, that's it. Mpacho, bet me a question.
yo, me that's it. Mpacho mama tinani. Dr. Mpacho, obi bisa say diabetes no. Dear sentence na okay can sentence say obi a ojo nso bebree.
obi so ɔyɛ adeɛ kakra bi a na wabrɛ na bi a wo lose weight nso so but me deɛ no medwen so bebree me yɛ adeɛ kakra bi so a na asɛ mabrɛ afei so me gain weight but me 2 weeks ago me call me doctor o check here me nya diabetes ne bi na me pressure so yɛ normal nti me ntimi hu ade kora ya na kakra bi a na mabrɛ na medwen so bebree no so ɔno so yɛ de adeɛ mpakyɛw
Enti o doctor no ɔyɛ test unim test ɔyɛ
mpakyɛw ɔyɛ diabetes test ne nyinaa ɔyɛ ma me kɔ
A1C.
black yeah
Aye.
yeah
Enti for some people was say my oral glucose tolerance test, meaning the umbe lab ma sugar anom. Now check sugar no after 1 hour, 2 hours. And no na you use it to diagnose pregnant women. Enti say blood work that comes so fine. That's another test to do to make sure say you don't have diabetes. Say if it comes back normal, that means that your symptoms are probably from something else that they have to investigate because and you're normal to be urinating all the time, except say if you're taking some medications.
Minna medication be also.
With no medications, say oral glucose tolerance test normal. They have to find out why. There's another condition called diabetes insipidus. It's completely different from diabetes mellitus, but they have a problem with their brain, their pituitary gland. But those patients know that they can hold urine. Every 1 hour or 2 hours, they're in the bathroom. They just urinate constantly around the clock. It doesn't sound like you have it. But yeah, that is the other type of diabetes.
That's
Mami ode me pacho o asam foforo ana we me hu so nsa wo soro.
Me pacho me obi bi a me busa.
Okay, obisa last question.
Okay, me that's it. Me pacho and say me nim san krofo bebre e de droso, right? Na me di kaka say, I mean ubusa me say me nya bia da na me say o me nya na me reverse it. And that was the other main reason I am a reverse them because and me to a droso. Na I know about 4 medications I will recommend and who say the effect, honestly, I panicked. And I'm cutting so in this case, I will try to reverse it myself. And so with all this medication, is that yeah, my friend say what far any side effect at all because all this medication is him say like what they're meeting now it was side effect. I mean, once you get it, there's also a potential because it's very, very difficult to maintain this thing. Sometimes it's hard. You go up and then you try to bring it down. You go up, it's very difficult. But just I'm just a potential.
A drobia was side effect. A drobia was side effect. And see, you take it for one thing, but if you can avoid it, great. But sometimes you can't, and it keeps you alive. But a drobia was side effects.
Then I will skip to my vegetables. That scares me. That's it. Sorry.
Okay. Dr. Claudia, Mipacho, Bibisa about coconut oil. It's not quite clear. Bibisa said, is coconut oil good or bad? I'm assuming good or bad for diabetes.
Bad. Coconut oil. Just bad. Too fatty.
Okay. And the last question, what Chadnimusu Bisa say? Can you please talk about blood sugar monitoring device like the Descom G7 and lifestyle instead of normal glucometers?
Into continuous glucose monitors, we Freestyle Libre, Dexcom, they are called continuous glucose monitor. They go in the a small tube, and a needle. It's not a needle that goes in the arm, it's just small tube, but it goes in the arm, and it measures blood sugar around the clock. Problem is say insurance companies say take insulin or a lot of times, insurance company, they won't even pay for it. But insurance company, it's here for those monitors now will keep track of your blood sugar. So you can see what the blood sugar is at any time, and you can see what foods affect your blood sugar. And they are very important. They are very crucial in managing diabetes. Eventually, you hope you say a backup, but for now, no, insurance companies, no, they give us a hard time. Sometimes Amazon turn their own Stella. There are some companies almost glucose monitors. No, you can look into buying one from them. But Libre and Dexcom, no, yeah, it's difficult to get the insurance companies to pay for them.
Yo, Dr. Edase, Vida Buampon, I send this over to me. If I chove it to me, Akasa.
Hello.
Hello. Okay, Pacho Kasa.
Me pacho me say bisa nye diabetes but na me pese me bisa se unum blood pressure medication ti ma wo ye kese ana.
Debbie. Blood pressure medications and Debbie. Some diabetes medications, insulin, bemo ayekesiye, glipizide, bemo ayekesiye, but usually in your blood pressure medications.
Okay, yeah, me that's.
If I chove it, you mo send bisa.
Pacho maybe said there. Diabetes, no, not the glaucoma or the banana.
Pacho say
glaucoma, and you are diabetes, not the banana there, or you different.
Debbie, glaucoma a pressure na when you know a high. Usually,
okay.
And from diabetes.
Okay, me that's it. Na type 2, na yeah, who ya na Rebecca?
Type 2 a journal controlling, na a man but a controlling.
Oh, don't go to Asakra.
Me pacho, me question say who need diabetes. So now who was Zambic? So they obey and also and won't 77.
So who need diabetes now no Ozempic.
Bye, who was Zambic?
Say Ozempic no say also and I said what gaining weight it can lead to diabetes. And who need diabetes now also now Ozempic now keep weighting down. A boy, if say eventually no so when your diabetes grab a delay. And na a boy. And a boy with blood pressure, a boy with cholesterol, a boy with other things if you lose weight.
It's who was Zambic now, because this time
Yeah.
I'm out for a take it.
Ozempic na yeah, but Ozempic yeah for diabetes. Yeah, na insurance company they won't pay for it if you don't have diabetes. Two medications are similar to Ozempic. So we need diabetes. We go Vinazepam, and yeah approved for weight loss, but Ozempic yeah approved for diabetes.
Pacho, before I send bisa.
Mpacho now weight loss you know a side effect mpacho.
Weight loss medication, no?
Mpacho, yeah.
The common side effect here, nausea. Nyoma move through digestive system slowly into a lot of the times nausea. I don't know how to say that in Chi, but and a constipation. Because food move through slowly, some patients get constipation. And sometimes diarrhea. Some of the food doesn't get digested into it, just comes through into it can come through as diarrhea. The other serious and important complication is pancreatitis. Pancreas may be inflamed, and yet that common, but it can happen. But the common ones are the nausea, constipation, and diarrhea.
Because me doctor no man be, but me fan that. Well, me na me go me say me so. Because me gain weight to the dog.
Debbie said, okay, anyways, I try. If you say, yeah, started with a very low dose. Low dose, no, ain't affected weight or your sugar. Low dose no is for us to see how you're doing with the medication. When your side effects are low dose na untimi take yeah na you jai a drone and I continue cry. Yes, I try at least try and see how it affects you with the low dose. It's yeah.
Doctor
Yeah.
Mpacho, also nausea and I'm saying tree. I am now obo better
Overflow
food.
I that's it.
You know, obo better food.
Yo, but tell me to my baby.
If I try.
Yo, me there any question, but so doctor I can't in your vegetables. I wish I for say look, your food pantry. Now for the whole or buy apply program be with some Spanish organization be. Into any other cafe say just can from Catholic charities, no. Omunya more, but Selu Pantry, is one of the biggest food pantry in the Bronx. Tidiana Okan say line no so but not Spanish for nkwa. Ana edim. Minim say vegetables are can chale uko see town everybody. Uko ufa bia contomri spinach. Just a small box First na 99 cents and then number 3.99 $5 near day. Say your bus and look food pantry no more yes you be bia. Mama ya mama didn't say that maybe it is worth the trip. Aha. And now Bianca, you bet me say buska kakra na ja. You knew an so do time bia. And I'm some vegetable board dinty. Na ya koto other things no. If you bet me aboa ya ma atime improve kakra me de ka ho no madam wase.
That's it, Deacon. But your last two questions, I will chat maybe sir doctor, then we proceed with the next on the program. Obi Bisa say, can diabetes mellitus, that which is type 2 diabetes, a bit to me at a cause any fra, can it lead to blindness?
I say if left untreated, blood vessels. No, let me go back to that slide. But blood vessels no, in the eyes no, it started to bleed and burst. Into a releasing blood, it can cause blindness. Yes. And by the time the blindness occurs, no, it's too late. It's very important to get the diabetic eye exams. If there's something going on, they can pick it up early. By the time you actually have symptoms, no, it's too late.
Okay, last one. Obinso Bisa say, a nebema will creatinine levels across through. What will make your creatinine go high? The levels go high. I think it's on Obinso Bisa.
Yeah, so that there are a lot of different things, but specific to diabetes, kidney, the kidney, takes up some of the sugar. Sugar starts to damage the blood vessels in the kidney. Kidney, leaky proteins. That's how that affects the kidney. Doctor check the earlier sign with microalbumin. At times, kidney blood tests are normal, but microalbumin are abnormal. Who said you have to take precautions to bring the blood sugar down because that can progress to kidney damage, basically. Answer that question.
I believe it makes sense to me. Georgina Athan Pacho. Oh, question, is it fully answered? Yes to me, so I'm assuming. Or I'll say Annie.
Okay.
Okay. Dr. Claudia, thank you very much. I think, sir, we have come to, last question. iPhone, you be the very last question. Over to Makasa. Go ahead with your question.
You're on mute. Or mute.
Sorry. But my question is, only diabetes, but you have flashness on your eye. But you say, no matter about that.
I know you're different and you're from diabetes. It could be a number of things. I was so who eye doctor more diagnose you. And now your eye surgery. Why eye surgery? So your eye surgery.
Me pa sure there be, but
Aye.
na menyam no na me yamo ka se me wo ye ka de say. Me wo prim ye ka de say diabetes. I don't come.
Pre-diabetes, gestational diabetes.
I say
Gestational.
I gestational yeah. But
Mm-hmm.
me wo ye no ni me mu bi. Ba me
Mm-hmm.
family no omo obi. Me papa nya bi. Enti no me call they say me call hospital mo say me bi anymore. Me free diabetes. But you have me na flash eyes. See na me business say no.
Aye.
Anytime I'm in your master.
There be any from diabetes, but also who eye doctor. No more
Actually,
check it.
okay, that's it.
Mpakyɛ ɛma ɔmo nyɛ diabetes ɛyɛ bi hɔ ɔmo nyɛ ikuro wɔ ɔmo nan ho ɛno so ɛbaa ne sɛn.
I say a slide a blood vessel say nine no their blood vessels carry blood to nine no. Nti say a blood vessels no a essay from sugar na unya blood flow and na a say unya krona ebewu no uhia blood flow. Nti sɛ wonya blood flow a ekuro no wɔ hɔ a enwu da. Nti at times ekuro no ɛkɔ bones no spread it from the skin to the bones. Nti some patients they have to get amputation. Nti that is how it happens.
Okay.
Okay,
But
thank you very much.
can I say,
Okay.
Louisa, I'm most of the can I send this Pacho.
Okay.
Mr. St. Luke's Pantry, Mrebe, and it a dabe no much as I did, and it also be no comes to say, come an announcement to us, so the mammy called Lani and papa be brain balan, so it be brain in him. Say to me announcements no was sorry the man and be brain, and who say na St. Luke's Pantry. Mammy who know a brain dan Pacho.
Yo, so ya can't baby a chum, but Fridays between the hours of 10 and 12. 10 and 12. And now from time to time, come the notice people ball. Tia, chemo I saw the animals, you reading notices na bobo no. Sometimes be an bibi papa bi kura other than normal supply no cray but the bobo. But Fridays 10 to 12.
Thank
Yes.
you.
Yeah.
Pastor, can I every Friday?
Me pacho
Every
ani.
Friday. That's it.
Okay, yeah, that will be say, Dr. Claudia, thank you very much. Yeah, your questions and answers, ni besiha. And just a little overview of Dr. Donfe, ni biography, in case they be a make kind of na anybody being joining. Your friend, Dr. Claudia P. Donfe, and she's an endocrinologist in Laurel, Maryland. She received her medical degree from the Albert Einstein College of Medicine of Yeshiva University and has been in practice between about 11 to 20 years. Dr. Claudia Donfe is the daughter of Mrs. Teresa Donfe and is a sister to our young adult Erin Donfe. She's a specialist in endocrinology, diabetes, and lipid metabolism. Dr. Donfe treats hormone-related conditions, which most commonly include diabetes, thyroid disease, pituitary gland issues, and hormonal imbalances. And she's also a practicing Catholic. And see, this is a little background of Dr. Enoni Kasai. Thank you very much.
Thank you. Thanks for having me. Now, I will send my email address in case people have more questions. They can always, reach me if they need to.
Nti Dr. Si odini email beba ebi our question when your time and bisa, then when you email, you can reach out for further assistance. You'll be asking. Mr. Patrick Yabua, ubetumi atwa so with the membership drive.
Yo, medasi Louisa. Yo, GD4 and Jumedia Kosu, a charismatic renewal group for na CNA, so I shama Jumedia Akoso na charismatic renewal group, a Kuewa sorry moi. yɛboa ma agyidifoɔ ɛtumi de adoma kyɛde ahodoɔ a yɛbɔɔ yɛ su yɛhyɛɛ den Honhom Kronkron de domyɛ no ɛdi dwuma ɛwɔ asɔre mu. Nti no wobɛka ho a yɛwɔ ministries bebree a ɛwɔ charismatic renewal group no mu a ɛbɛboa ma wɔatumi de nso w'adom akyɛdeɛ a Nyame de adom wo no wobɛtumi de adi dwuma de aboa ama yɛatwe akra aba Nyame ɛfie. Ministries ni be a teaching ministry, healing and deliverance, evangelizing, and then intercession ministry. We have praises and worship ministry. So what do much to any ministries no baby boa mo watimi ama sad much dia Nyame nkronkron de domo no wodi be di dwuma na also so watimi de aboa ama asore na tumpo yɛyɛ Bible adesua ne yɛdwumadi aka efiada bi a nti sɛ nkɛnyɛ sɛ yɛyɛ wɔ LAITY week a nkɛnyɛ Fridays nka yɛhyia nti yɛsrɛ sɛ obi biara mmra mmɛka ho na yɛn nyinaa yɛnsua Bible na yɛmfa ho kronkron adom akyɛdeɛ a ɔde adomyɛ no ntu anammɔn. Yɛhwɛ holy name ɔmo quiz ɔmo yɛyɛ a akuokuo dodoɔ na members ɔmo bɛ represent ɔmo no emu dodoɔ na yɛ charismatic renewal for members. We edi adansi pefe wɔ nam yɛ ne showba charismatic renewal group yɛboa St. Luke asɔre ama ne tumpɔn nti yɛto nsa frɛ obi biara sɛ mommɛka ho. Ukwu a wom no wobɛjoin ne charismatic renewal group na ɛno nkyerɛ sɛ wafiri kuo no wobɛsɛ tumi akɔ so adɔm kuo biara yɛboa ama nimdeɛ a ɛwɔ twerɛ kronkron akɔ so. Awurade nhyira nyinaa. Amen.
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 Amen. God bless you, Patrick.
Pacho yede ene dwumadie ni nyinaa abawie yebedi kan ada Nyankopɔn ase throughout the week from Monday to Friday. So waboa yɛn ama ye program na ye very very successful. Afei so ye da Mrs. Margaret Brobe ase so di ye ni ma ye see ye rosary. Mrs. Brobe ye da ase Nyame nhyira wo. And I da Mrs. Agatha Bedinanso ase for that wonderful ministration. And also, Dr. Claudia, we want to say a very big thank you to you. We thank you for your time. We thank you for your expertise and your knowledge that you've given to us. Also taking the time to answer our questions. So you better suffer for so I say from Monday, Tuesday, Wednesday, Thursday, Friday. Father Paul and I suffer for you now joining you every day. And then Mr. Patrick here, boy, thank you for going over charismatic renewal. The different event, the different committees, one programs, whatever charismatic stands for. Thank you for that explanation as well. Also, your technical team, I say, thank you very, very much for all your technical assistance. And last but not the least, that we all make time, even with our busy schedules, to come, listen, and participate in our program throughout the week. Finally, on my part, we will take an announcement from the liturgical committee into Mr. Hubert Imprim or who will take over with that part. Thank you.
Mr. Louisa, Yadawasi. Well, so Yadawasi, pa, what did you do any mama bibia koso? God richly bless you. But before I'm a day announcement, Bebano, Mestre said, I sorry penny Mr. Seya. And now say, Yama, vice president, Antisali Oswa. Omunye quick announcement for a Yambuechna picnic. You are not part of the announcement number. So Muniswa, then I will go ahead and do it.
God is good.
All the time.
For yes, Lemon Sanka, Braymon Shannon, so announcement, Kofi Crotch, Mr. Announcement, no, I know Edding, Tina, or Yamaka, announcement like Kofina and Kabe. I was for the old honey say, Yen who now watch you media yet, dear, it a share at the end Munyam. Na Tession Qua and Nanti, 18 Amia 7 do a be an all say, and so ye G and Nikakra. Na Nitinaka or China Jume